My name is Sam Siegel, two times Hodgkin lymphoma survivor, BMT survivor, and primary care physician doing survivorship medicine. And I'm here today to have this wonderful conversation with Dr. Natalie Grover and Dr. Stephen Ansell about Hodgkin lymphoma updates. So, I guess right now we just love to understand a little bit more about Hodgkin's lymphoma. And so, Dr. Ansell, can you tell us what is Hodgkin's lymphoma?
Yeah, so I think really important always to have a good understanding of the disease, and I think what's unique about Hodgkin lymphoma is a number of things. Number one, it's a glandular cancer or a cancer of lymphocytes and lymph nodes. So many times people will show up with a lump in their neck or a lump under their arm, and one of the lymph nodes has become really enlarged. It needs to be differentiated from non-Hodgkin lymphoma, which is really a similar disease in that it also affects lymphocytes, but under the microscope, these are very different. Non-Hodgkin lymphoma often has lots of cancer cells present. Hodgkin lymphoma really has only a very small minority of cancer cells. These are the Reed-Sternberg cells present, but those Reed-Sternberg cells have attracted in a large number of immune cells that's caused the lymph nodes really to sizably get bigger. And the thing that's interesting also about it is Dr. Grover spoke about this being a systemic disease, and it is, but it's interesting in that it migrates in almost a kind of a fashion of going to the next set of lymph nodes in a much more kind of stepwise way than non-Hodgkin lymphoma, which can kind of show up everywhere at the same time. There are a lot of unique properties about those Reed-Sternberg cells. They have proteins on the outside, and I'm sure we'll talk a little bit about some of the targeted therapies, but those targeted therapies are going after those proteins to make it very specific to just the cancer cells, far less to the other cells. And to your point about side effects, then can be kind of more, it can be diminished because the treatment can be more focused. I think there are lots of other things that we could talk about how it's different, but I guess the takeaways are just to know that it's a glandular cancer of lymph nodes, if you like, often affects young people and older people, whereas other lymphomas often tend to be older people and is highly successfully treated.
Thank you for that. And it's a blood cancer, right? But it's in the lymph nodes. Could you just give a little blurb about that? Because I think that's confusing for people sometimes.
Yeah, so lymphocytes are part of your body's defense, and they typically will react to proteins and viruses and other things that would bother the immune system, and they will turn into cells that make antibodies. So generally, they travel around your body. They are born in your bone marrow, travel to your lymph nodes, travel in the blood to any tissue anywhere. But along that path, they can get stuck as they become abnormal and cancerous. So you can get them in the bone marrow, you can get them in the lymph nodes, you can find them in the blood, or you could find them everywhere. Hodgkin lymphoma, though, really likes the lymph nodes and tends to be predominantly stuck at that phase. But the blood cancer comes from the fact that they travel in the blood as they move around. And also lymphocytes are blood type cells, hence the blood cancer different to solid organ or solid tumor types of cancer.
Thank you so much for clarifying that. And Dr. Grover, could you tell us a little bit about what are some common symptoms of Hodgkin lymphoma?
Absolutely. So many patients with Hodgkin lymphoma can present in several different ways. Sometimes you may have a patient who just comes in, as Dr. Ansell mentioned, with an enlarged lymph node, so an enlarged lymph node or a lump on their neck. And usually a lot of the patients it starts in their neck. There's some patients may also have an enlarged lymph node, kind of in their axillary or armpit area. And then sometimes patients can have kind of other symptoms that can present with that as well, or other symptoms such as shortness of breath that may be related to a big mass or a lump in their enlarged lymph node in their chest area, and that can also happen as well. And then patients can also have these B symptoms. So patients may come in with these other more kind of widespread symptoms such as fevers or night sweats, where they're really sweating at night, having to change the sheets, or losing weight without trying, and then may have other kind of curious symptoms such as itching that some patients may present with as well.
Thank you so much for that.